Skin cancer can be a pretty scary diagnosis for anybody being diagnosed with it. Obviously, there are a lot of things up in the air, and what the next step is going to be is something that obviously preoccupies people who are diagnosed with it. Skin cancer is very common in the United States and the Western world. Many people are afflicted by it. The thing about skin cancer is that a lot of people don't realize they have it until it's too late, or later than what we'd like, meaning the tumor or the cancer is larger than what it started out as. And that creates for a bigger problem to deal with, bigger surgery, maybe sometimes even metastatic disease. That creates for a much bigger problem for the patient to deal with, and obviously their treating physician. In this video, I'll go over a few stories that I've collected over the years of patients that came into my clinic not remotely suspecting that they had skin cancer, leaving the clinic with that diagnosis or that possibility without ever having thought that they might have skin cancer. We'll go over how they showed up in my office, what was their main concern, what I found out on physical exam, and what to look for yourself in case you're wondering, do I have skin cancer? Before we get started, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Now let's get going. So I saw Joe, who's a 73-year-old retired Boston PD officer at our Fenway Park office back in my Boston days. And Joe came in for a regular skin exam. He did have a history of skin cancer in his past, and he had no complaints, no concerns of any kind. He just go for it, just take a look at my skin. So as we went through the exam, I spotted a 1 centimeter large sore or ulcer on Joe's forearm, on his right forearm. When I asked them how long he's had it, they said, oh, this thing, well, I've had it for a couple of weeks, and I think I might have banged into a door or something. It almost healed, and then I just picked at it, so it opened back up again. That turned out to be a squamous cell carcinoma. Not a small deal. Squamous cell carcinomas can actually grow very rapidly and can potentially metastasize to other organs in the body and the lymph nodes. So squamous cell carcinomas need to be treated pretty promptly, usually by surgical excision. There are other treatment options. So what was Joe dealing with? Well, he was dealing obviously with a squamous cell carcinoma. Another thing that's actually pretty common in people who develop skin cancer is that many of them actually have a pretty good story as for how the skin cancer appeared on that area of the skin. Sometimes there's trauma involved, meaning they brushed up against a branch, or they hit a door, or they hit another object, or maybe they scratched the area. And the area opens up, a sore forms, and then it doesn't go away, it doesn't heal. And they're just thinking, well, it's just going to go away in a little while. Not understanding that there is a time frame for sores to heal on the skin. Most sores on the skin, unless there's an extraordinary condition to the skin and the skin is not properly vascularized, or there's another problem, another fundamental problem to healing in the body, such as diabetes, most sores heal on the skin within a couple weeks. So if a sore sticks around for more than a couple weeks, that's a good sign for you to seek medical attention and see a dermatologist and figure out whether this is skin cancer or not. By the way, sores or ulcers can be the presenting symptom for many types of skin cancer. It can be the presenting symptom of squamous cell carcinoma, as in Joe's case. It can be the presenting sign for basal cell carcinoma. It can be the presenting sign for a melanoma, as well as other skin cancers. So do not dismiss a sore that does not go away. Staying on the skin for more than a couple of weeks, go seek medical attention and clarify your situation. So Bridget, who was a 53-year-old executive assistant from Cambridge, Massachusetts, came into our office one day to freeze a couple of spots on the face. As I looked at her entire face, examining it, I noticed a little pimple that had a little crust on top of it, right on top of her nasal bridge. When I pointed out the pimple, Bridget said, oh, this? I got a pair of new glasses a couple weeks ago. I've been breaking them in, and I think it chafed the bridge of my nose, and that's what happened. As it turned out, Bridget had a basal cell carcinoma, which is a very common type of skin cancer that can present as a pimple on the skin, or maybe even an ulcer, as Joe's squamous cell carcinoma presented. It is fairly easy to treat, but the longer you let it go, the longer you let it fester, the bigger it's going to grow. And that can mean a larger surgical excision or a Mohs procedure, which is another type of surgery that is used to treat tumors like basal cell carcinoma. Ultimately, you have to notice these things early and not explain them away as Bridget did. Jean was a 65-year-old retiree from Dorchester, Massachusetts. I saw her back at our Boston Medical Center clinic. We completed her skin exam, which was pretty unremarkable, and then I noticed she had a Band-Aid on the ankle of her right foot. When I asked her what that was about, she said, I got a brand new pair of leather sandals and I've been breaking them in. I think it chafed my ankle. So I asked Jean whether we could take a look under the Band-Aid. Sure enough, when I removed the Band-Aid, I discovered a 4-centimeter large ulcer, which turned out to be a malignant melanoma. And you can see how Jean, just explaining away this chafing thing on the ankle, actually lost a lot of time to the diagnosis of her melanoma, which was actually fine to not metastasize, but could have very well metastasized had she let it go longer. She was treated with surgery and was followed up by oncology. But that should serve as a lesson to you. Do not explain sores anywhere on the body by persistent chafing unless you've clarified it with a dermatologist. That could be a sign of skin cancer. And what a lot of people don't consider is that skin cancers form abnormal tissue. Abnormal tissue tends to be more fragile, and that means that even with a legitimate story as for how you got a sore or a chafe or an ulcer or a pimple, something that sticks around for more than a couple weeks on the skin and continues to get crusty and continues to open up is abnormal skin. Whether it's a skin cancer or something else, it has to be looked at by a dermatologist to find out exactly what's going on here and determine what is the cause of that constant ulceration of the skin. Owen was a busy 65-year-old lawyer from the south end of Boston who came to my Fenway Park clinic to treat warts on his hands. Owen declined my offer for a full skin exam, but agreed for me to examine his sun-exposed areas, which led me to spot a 5mm bump on his cheek. When I asked him about the bump, he said, oh, this? I had this pimple. It's been around for a couple weeks. I squeezed it. I think I made it mad, and that's why it's still here. I took a closer look, and as it turned out, that was a basal cell carcinoma as well. And here we are with another story where the patient developed this lesion and explained it away by thinking, well, I just squeezed it, I made it mad, and that's why it stuck around. As it turns out, he actually had it for more than a couple weeks. He had it for a couple months. And anything that sticks around on the skin for more than a couple weeks, 2 or 3 weeks max, needs to be examined, needs to be evaluated. And the bottom line is that we have to find out what is sustaining this thing on the skin, whether it's a sore or an ulcer or a pimple or any other blemish on the skin that stands out, that is new, that has developed, and that can lead to early detection of skin cancer and save you lots of time and heartache on the way to treating your skin cancer. For more information on how to spot skin cancers on the skin, pick up my book, Sick Skin, Skincare Made Simple, on Amazon.com. Also, don't forget to watch my video on skin cancer detection hacks at the link above. Thanks for watching. God bless.